all teas, she says, are bitters.
I put bitters in my seltzer, like when I go to the bar now.
Oh, you know? Yeah.
I just ask for bitters.
Green tea on an empty stomach.
Hi, everyone. Welcome to the CURES Show, where we explore the cutting edge of wellness for the mind, body, and spirit. Precision medicine is really a cutting edge way of designing our wellness, and specifically solutions for your DNA and your needs. A Connecticut company is actually leading the way in helping you fight aging and chronic disease with specialized testing and medical grade supplements that are designed just for what you need. So here in our studio to learn more about this is Dr. David Brady. He's the Chief Medical Officer for Designs for Health. So thank you for being with us, Doctor.
Thank you.
And Debbie Wright, who is a certified health coach, who has helped many people, but has also helped her own journey of how to beat the things everyone's curious about, like menopausal weight gain and brain fog and anti-aging in general. You've really made a point in your life to optimize your health. So we're going to learn about your journey and how you're helping others.
Excellent. Yeah, the fun things about turning that magical age.
Well, we all want to get healthier and better, and bust that myth that you just go downhill after a certain age. So I guess let's start there. So much of what you do is about optimal health, which isn't maybe what people are used to, right?
Well, I think we were pretty much trained in our era growing up that you kind of wait till something breaks, and then there's going to be some magic bullet to fix it. And it doesn't always work that way. It's a lot better to prevent something from happening, like a disease or a disorder. But I think just people want to live a more active, healthier lifestyle into older ages than they were accustomed to in the past. So we're not settling for being disabled when we're 50 or 60 anymore.
Right. All right. So I want to go into a little bit of your background, Dr. Brady, because for those who aren't maybe supplementing a lot or just maybe picking up a couple vitamins at the store, you have spent your life studying clinical nutrition. And so what we're going to talk about from DNA testing to figure out what we need to the specialized vitamins that you sell through doctor's office, there is a big difference than maybe what you're just buying at the local store when you don't know what to get.
Yeah, the stuff you're finding on the shelf in a retail environment or a CVS or a big box store are pretty much nuts and bolts kind of supplements, vitamin C or vitamin D or this or that. And sometimes they'll get a little bit more specific to supporting a specific health challenge. But they're really more just sort of your average supplements. And they're, it's almost like cars, there's entry-level cars and there's really high-end cars. And same thing in supplements. There's ones that are made to really, really high quality standards using the most efficacious ingredients and forms of ingredients. And then there's ones that are made more for price points on a shelf in a discount store, and they're not the same.
Right, and not to say that everything you have is super expensive at all, because sometimes, minerals like magnesium or vitamin D, you're not going to spend a ton of money, but you're going through doctors because they might say, I know because I've been to a doctor who uses Design for Health, and they say, okay, you have a little issue with how your insulin, it wouldn't be insulin resistance by the typical standards, but let's fix that because it's not the number we want to see.
Right.
And so then there was a program, and one of the programs which we came in touch with you was like, she wanted me to do a reset with, I did a little cleanse with Designs for Health. And I guess everything I was putting into my body, the idea is it's all been really specifically formulated for me when you do that, but also what you do. Talk about the quality control of the processes that you go through.
Yeah, well, we've been doing this for over 34 years. I've been the Chief Medical Officer for over 20 and the primary product formulator, but we go through extensive sourcing. We go through extensive analytical chemistry from every raw ingredient to final batches of the actual product, and we do so as they age as well and sit. So it's really an extensive, it's a nutraceutical grade type of line. So
what's a nutraceutical for people who don't know?
It's basically treating nutritional supplements, botanical medicines, and other things that would not be formerly prescription medicines per se, but dealing with them in a very similar way from a quality control standpoint and from a science and efficacy standpoint, how you study them, look at outcomes actually in real patient populations, and it's quite an endeavor, but it's a fun one.
Well, I think what's so interesting, and I want to learn more about this, is, and we're going to talk because Debbie's actually done some of this testing, you have developed specifically with our technologies today some DNA testing, and even simple like urine tests or things that would actually say what I need or what Debbie needs, so you're not wasting your time and money.
Right. I mean, for a long time, a lot of the way people dealt with nutritional supplementation is what we call this for that nutrition. Oh, I'm taking this. Why? Because I heard it's good for that. Right? But it's very not customized.
Okay.
But today, with all of the emerging science, we use what's called omics technology. So we use genomics, like you mentioned, looking at your genes and what you may be more susceptible to than the average person, and where your metabolism and biochemistry may need a little support with more nutrients in certain ways. But we also look at something called metabolomics, and that's actually looking at your biochemistry in action.
Wow.
So step by step by step, like how you make energy, how you detox things, how much oxidative stress you're under, what nutrients you need in very specific reactions like stress biochemistry.
Yeah.
Someone like yourself who's fast-paced and under stress and under a lot of demand and on the go, that can
So you'll
take
be able
its
to
toll.
see from the test.
Yeah, so
what do
we'll
I
see.
need?
And then the final one is microbiomics, which is our GI spotlight, which looks at the gut, because the gut is so important as we're learning to people being healthy. It really sets the pace for your immune system. A lot of immune disorders like autoimmunity starts in the gut. The majority of the times. And so many people have GI problems, particularly as they get older.
Yes, I've noticed that with family members too, and trying to help. So Debbie, I want to bring you in because you actually did a lot of this testing.
Yes.
And I know you really focused, you always have been this way. You've always worked out, you always eat reasonably healthy. As you've gotten older and gotten into the field of health coaching, you have really worked to optimize your health. What did you find out when you took this DNA testing?
Well, interestingly enough, I was a little bit apprehensive, to learn too much. I think there's a little bit of fear, like, what will my genetics actually tell me? And I don't know if I want that, illuminating up there. But honestly, it was the best decision I ever made to really understand, just as Dr. Brady mentioned, how do I metabolize? There is no one size fits all, as we know, carnivore, plant-based, all the different buzz things that we hear out there, and how to manage menopause specifically. And some women and people get frustrated because they try all the things they hear about and they don't see the same result as someone else, right? So really taking the entire guesswork out of all of it and understanding what you're up against. Interestingly enough, I have some of the worst genetics. And, it was interesting to see and to learn that I have an inability to metabolize carbohydrates, saturated fats. All of these, like SNPs, they're called. I mean, not to get too into it, but I have, it's really not favorable. So it's been really liberating for me to see that given my genetics, I don't show any sign of any of the side effects that I might.
Well, because you've been taking care of yourself. So the
Otherwise.
point of knowing this is because you can change the trajectory of health, right?
Yeah.
So like in Debbie's case, what would you do if you learned this so you don't just go, oh my gosh, it's over?
Well, as Debbie talked about, she did some genomics testing and looked at her SNPs, but it's important to remember with genomics, most of the kind of genomics we're talking about, it's not telling you what's actually happening, it's telling you what's more likely to happen in you than the average person. So we're finding out where are your risk points, where are the places you will probably stumble going forward if you don't make better choices. But it's not a fait accompli. It's, you can play the hand that you're dealt, and you can play it in a good way or play it in a bad way. So your outcome is not determined just by your genes.
Right.
It's determined by your genes and the environment that you bathe your genes in. So if you bathe them in a better environment, you will get better outcomes.
Turn up the volume on the good genes, turn down the volume on the negative
and we know
genes.
how to do that. We can signal to the genes. And then using testing like metabolomics, that's not what's more likely to happen, that's actually what is happening. So we can actually look at what's going on in your unique metabolism and biochemistry, and we can find out, how can we make you healthier from the standpoint of being less likely to come up with a chronic disorder like insulin resistance leading to diabetes or cardiovascular disease, combined with other medical diagnostics, of course, blood work and imaging and all the normal stuff. But what we really love to do is help people feel more vital, have more energy, have more clarity, not as much brain fog, be able to engage in the type of activities with their family and their loved ones that they want to, especially as they get a little bit older, and not pay the price for it and still feel good.
Right. And that's, I think, let's go to the menopause conversation. A lot of people I know who listen to this podcast, or we talk on the Channel 3 Mom Squad, the idea that so many people don't know anything about it. I'll take Mika Brzezinski, came out and told on all of her viewers on MSNBC and online that she thought she was having some major problem. She had heart palpitations, she had brain fog, she was getting every test done. Turns out she's going through menopause, and she's like, why didn't anyone tell me? And even Oprah was like, I was having, way back when, heart palpitations. I thought I was dying, and no one told me it could be menopause. So we're really just learning about this. And I know you had your own journey of things start to shift, even years before the actual menopause, but what's going on? So to get that energy and to get that clarity, you don't have to live in that hampered state.
No.
And, we have a lot of lessons even from traditional naturopathic medicine that they've used for a long, long time, but now we've picked it apart and understand the science and the mechanisms by how some of these herbs, like Vitex or chaste tree and these different types of botanicals that have been used for years, we're understanding now how they're balancing out women's hormones, so it's not such a wild swing. We're looking at not just the hormones themselves, but how your body metabolizes those hormones. Because it breaks down hormones. It has to clear hormones because more are coming, more are being made. So the ones you have to get eliminated, or you end up with too much of a hormone. So where supplementation and botanical medicine could come in is sort of the complement, even hormone replacement therapy. Like some women are getting what's called bioidentical hormone therapy, very customized to them, not just an off-the-shelf prescription, but a compounding pharmacy making it very specific in the amount of estrogen, the types of estrogens, the different and the level of progesterone. Well, we can complement that with various supplements and botanicals to kind of keep it from being a roller coaster and keep your metabolism for something like estrogen. It's also a risk factor for breast cancer and so forth. So we can look at what type of breakdown products are occurring with your estrogen as you metabolize it, and are they risky or are they beneficial? And we can shift it.
So Debbie, what did you do with all this science, and how are you advising other women? Because I know you've been able to actually lose weight after menopause. You've certainly kept your muscles. You look great. So what are some of the things that we can take away?
Well, first of all, I get so excited just continuing to hear. I just feel like aging is so exciting, and we're living during this time that we have access to doctors like Dr. Brady, and I would truly. What I do is really encourage women, if your current scenario, you don't feel like you're getting information that's going to help you, get past your symptoms or truly understand what's happening in your body, that you connect with doctors who are practicing all of this precision medicine. I think that term is so powerful, because to me that means, what am I going through right now? Just like you talked about Mika, who knew that the symptoms she was experiencing were related to menopause. And I want women to believe, and what I talk to all my patients about, is there are places to connect with the medical community who will look at your entire body, who will look at your whole self, who will take you through all of these personalized tests to be able to guide you to how to optimize, avoid disease, feel your best, and just navigate as we're getting older, the ability to live better than we've ever. I feel like I really do feel better than ever. I know we were chatting earlier, I hope you don't mind me saying, but you don't take any prescriptions, and when you went to the doctor at one point, they thought it was so strange that, wait, what, nothing? Because it's so,
They couldn't believe it. I had the conversation 3 times within the same office.
Isn't that great?
That I was on no prescription medications at my age.
Yeah.
And
Like,
do you share your age?
I'm going to be 60 very shortly.
Okay. I have a husband who's the same way, and they always think it's strange that he doesn't have any prescriptions. But
And it's
not that you
possible.
can't, because
Right.
a lot of functional doctors will say, hey, that's the
need
next question I have. If you are on a prescription and it is working for you and you don't have any side effects, you can still do some of the supplementation.
Oh, sure. We use prescription medicines all the time. They're necessary in many circumstances. So it's not a one or the other kind of scenario. It really is a complementary thing. But, you know, there's no doubt, and people have understood this for a long time, but the pandemic really highlighted this. Yeah. You know, the healthier people were going into that, the better their outcomes were. So there's a lot of people that are interested in being healthier than they may have been before, and really trying to age better. And, you know, the healthcare system, you know, whether we like it or not, it's pretty much a disease reaction system. It's wait till you get a disease and then we have these heroic things. And it's great that we have them, but there's a place for being preventative and proactive, and there's not enough emphasis on that. And we talked about, you know, precision medicine. That touches a lot of things, including modern precision cancer therapies and so forth, but precision nutrition and precision lifestyle changes are where you can really move the dial and keep people healthy before they get sick.
There's a statistic I remember from interviewing Dr. Artemis Morris on CURES that 80% of our chronic diseases can be prevented or changed with diet and lifestyle.
Absolutely.
So 80% of some of the things like diabetes, weight gain, all this. So Debbie, women are going to want to know, I got to get some specifics. Like, so what did you do to turn the clock back on not gaining the weight or even losing weight during menopause?
So I learned that through all the testing, you know, I had actually tested for autoimmune, which I never knew I had. You know, I was borderline also during the time of perimenopause of high blood pressure, which I never knew because my continuous routine of doctors, it was always the same. No one said anything. So by working with my functional doctors, I started to cater my food differently. I took on a shorter eating window, intermittent fasting, if you will. I started to supplement in accordance to what, you know, they found with different symptoms and different things that were happening. So I would say understanding my metabolism, understanding there was an order for me to eat food, like eat my vegetables and my protein first, minimal carbs, which I kind of always mitigated carb, but not like this was intentional. And knowing where to, you know, kind of eat that sweet spot. And for me, not eating 3 to 4 hours before I go to bed had profound impact. And, you know, I never really paid attention. I never really ate like up until bedtime, but, you know, like little tweaks. I think to realize that those little tweaks have more powerful impact than you might imagine. Really prioritizing sleep, making sure I was hydrated, like really nothing outside the norm other than really dialing into the quality of my foods, dialing into quality targeted supplementation, working with a doctor who I then monitored my signs with, you know, every 3 months would go back and everything improved, and I have no more autoimmune. My blood pressure is so good right now, and that I attribute to the infrared sauna. So other rituals too, like doing sauna and cold therapy, prioritizing sleep, all of it I really feel has made such an impact. Like my genes that I'm, you know, hereditarily wired to show signs of, you know, possible turn on in disease are not.
Well, interesting enough, I know you've talked publicly about this, you are adopted, so you didn't know a lot about your family history.
And thanks, they didn't have great genes.
Okay, well, so but when we do these tests, then I would imagine, Debbie is very disciplined. I love her, but she's very disciplined and organized, why she does closets and health coaching. But like some people might get some range, oh my gosh, but I still want my pizza, I still want this. This isn't about deprivation, but do you find that when you can give people precision answers about what they need, they're going to be more compliant?
Yes, because you can figure out where you'll get the best return for your effort. So sometimes people just are confused. There's so many options out there. There's so many different things that they're told to do, and they change from 1 month to the next, you know, depending on what's hot and what's the trend. But if you test and you use objective data, and then you work with a very good healthcare provider who understands these, they can triage it for you, and they can say, you know, we found these 6 things, but I think if you just really concentrate on these 2, will start moving the dial.
Yeah.
Right? And then if you get traction with somebody, and it may be that they feel more energy, it may be that they lose a couple pounds, it may be that they don't get headaches, it may be that their antibodies go down on an autoimmune test, whatever it may be, if you motivate them, then they're more willing to engage in more and more things. It really becomes almost a feed-forward thing. Once you show people they can make a difference in their health outcomes, they're more willing to engage and not just give up.
And so many people are struggling with focus, with energy, and with mental health issues, anxiety, depression.
Absolutely.
So much of that could be turned around, especially people don't realize that sometimes those emotional impacts are part of menopause. They might be having brain fog, they might be having anxiety, they might be having all those things. So that kind of stuff can turn around pretty quickly. I noticed, I know women who have said that once they started supplementing with the right stuff, their hot flashes went away in days. And other women have been living with them for years. So there are solutions to this, right? So let me ask you this. There's also, like, people will be like, oh, there's also snake oil out there. Like, there's the stuff that people are buying because they heard it's good, and like you said. And for instance, so many people are on Ozempic, and TikTok has had a moment saying, oh, berberine is the natural version of Ozempic. You've brought berberine here. What's the truth about it?
Well, it's true that berberine can help insulin resistance and blood sugar, and there's really good studies, outcome studies on that, human clinical controlled trials on it, so there's no doubt about that. But I would say it's an overstatement to say it's exactly the same as Ozempic. It shares some of its mechanism of action, but it's not as strong of an effect as taking semaglutide or Ozempic. But it also doesn't have some of the potential side effects. We're still trying to figure out what are the side effects of Ozempic going to look like when we look at it 10 years down the road.
Right, and that's, I think, I mean, I've seen people lose incredible amounts of weight, but you're like, okay, wait, the New York Times is saying you have to stay on.
I've used it with patients, patients who don't have like 5 or 10 pounds to lose. We're talking about people who really have significant insulin resistance and have a lot of weight to use. You can use those types of agents to try to start moving the dial and getting motivation again, showing them that there is light at the end of the tunnel. But I'm not personally a fan of just blanketly putting people on it and staying on it long term.
Right.
I think we don't know enough about it yet, and it's, I understand why people are intrigued by it. It's sort of the easy way. You don't have to make all these changes, but there's concerns about it. It doesn't replace eating well and doing the right things, but it can be a tool we use intelligently.
Right, so sleep is always the drug of choice, and then the exercise and all that. But beyond that, this precision medicine, let me talk a little bit about, as I know I could talk to you all day, but if you're on the internet, and there's been a lot of concern about this, especially in our moms group, of like, oh, ADHD and focus, whether it be in adults who want focus and energy, or kids and the parents, for whatever reason, medication can be life-changing, I know, for some kids, or maybe they want something in addition to it, or they just don't want to use it. But there's all this stuff out there now, all these brands being advertised all over Instagram of just take this quiz, and then you take these supplements, and it's the same as Adderall, or it'll give you... Can you dive into, like, none of these natural things are quite the same as the prescription drugs, but could they be replacements, and what do you worry about the stuff that's on the internet?
Yeah, I think, the whole adage that the supplement industry is unregulated, well, that's just not true. What's true is they're not regulated in the same exact manner as pharmaceutical prescription drugs are, and for a good reason. But they are highly regulated. I mean, our manufacturing plants, our quality control centers, they get audited all the time. We're independently audited voluntarily by NSF. All of our facilities are NSF certified and go through multiple audits, but we get visits by FDA and others. So,
but not all supplement companies, right? Do
like whatever they're all subject to the same. They don't all do the same kind of voluntary audits and quality control a professional brand like us would do, but they're all subject to FDA drop-in audits, and drop-in. But many of them are not manufacturing their own things. They're contract manufacturing, and they're reselling. So they're reselling it online or through social media, and they're really kind of smaller, fly-by-night, ship from their garage type of operations.
Literally, sometimes it might be coming from someone's garage. Sometimes. You have to be careful when you're getting on Amazon.
Not manufactured in it, but that might be where it's being shipped from. It's a much different animal when you're talking about large professional nutraceutical companies like Designs for Health. So, like I said, like the car analogy, there's Ferraris and there's old beaters that are blowing smoke out of the tailpipe.
But when it comes to brain health, nootropics have a lot of promise of the idea of
yeah.
using nutrition and supplements to help with either attention, focus, energy.
Oh, absolutely. Just about every Silicon Valley CEO and executive is going through all this testing, wearing all the wearables and the Fitbits and monitoring everything, and they're almost all universally on nootropic agents, which are natural agents, nutraceuticals, different supplements, different phospholipids that are good for your brain. Basically help your brain work better, help the membranes be more fluid, you know, get rid of the brain fog, make you be able to concentrate longer.
What would they be?
There's many. I mean, many people would probably, the first one they would think of would be ginkgo biloba. It's very well known because it can increase vascularization and the small vessel blood supply to the brain. And you know, blood and oxygen is necessary for any cells to work, including the brain neurons. But things like glycerylphosphocholine and acetyl L-carnitine, and then there's different botanicals. We even use actually a coffee extract that can have a lot of
Ashwagandha?
Ashwagandha is one for sure. That's an Ayurvedic herb that's used for a lot of things. Used a lot in stress, actually.
Because you hear ashwagandha everywhere, that it's just going to help us de-stress, it's going to help us sleep. Right, maybe not for the Silicon Valley focus.
It's more of an anti-anxiety than a sharpness kind of nootropics are more to make your brain sharper. Ashwagandha is more to calm you and make you not as agitated or anxious.
But the bottom line is there are some great tests you can take. And so Debbie, this was, as we wrap this up, the idea of testing and using precision medicine. How do you go about finding someone who's going to help you do that? Because people are going, well, that's great, but you don't sell right to the public. And
no.
Debbie Wright is a health coach, so she can help you. But what's the best way to go about finding a good doctor who's going to help you do this?
Well, you know, when I was searching for other opinions, you know, when I was kind of stuck in this phase of menopause and not getting really any answers on how to get through it in the best way, I conducted my own research and started looking under the umbrella of integrated medicine. I started listening to podcasts, how to come out of menopause in the best way, how to be healthy through menopause. So I started to plug in and do my own research. I did a Google search locally, and I started to interview different integrated doctors who, and many of them practice and have had background in medical and now have come over to functional. So I think it's just so exciting to open up conversations with these practitioners who practice precision medicine.
Can insurance cover some of it?
It can. It depends on the physician and how they structure their practice.
I found a lot of times the blood tests will be covered
standard blood tests. Some of the more modern omics testing and all is not generally covered.
Yeah. But it's not always super expensive.
It's not super expensive. For the amount of information you get.
You could spend $200 and maybe get like a whole workup on certain things, right?
And you can get answers to something you've been struggling with for years, right? So, in my opinion, it's a much more efficient way to go, because when you're acting on data, for me as a physician dealing with someone, let's say with a complex chronic health condition that's been going on for 20 or 30 years, I want to know, I want the data, I want to make intelligent decisions. Now, I've been doing this 30 years. I can often make pretty good guesses just by talking to somebody and look in their medical history and their standard tests and so forth, but it's much better with the precision data, and you actually don't end up going down rabbit holes and ending up what I call rattling bags of supplements that some patients come in with, because they're not taking the right stuff.
No, and so we all, like, it's like, you don't want to, it's like the women with our makeup in the bathroom. It looks like a graveyard.
Yeah.
We want to know that you're getting the right stuff and that it's working.
Well, we say test, don't guess. You know?
Test, don't guess.
That.
Let's leave it there because our time is up. But test, don't guess. Designs for Health is a Connecticut company. I know you've branched out. You've got other offices, but it was founded here. Yep. You can look for, I know there's lots of information on your website, designsforhealth.com.
There is.
Debbie, how can people find you if you want to help them navigate this as well?
At DebbieAllenWright.com.
Yes, and on social media too, right?
Yes, same, Debbie Allen Wright.
Okay.
Yes,
so
thank you.
I have found this, I share this with all of you because I'm not even down as specific as you are, but what I have done has really helped me understand, and also helps me be a little bit more compliant, I think, when I know that I can't do this right now. So I hope you are all having a wonderful day and that this will help you. Have a great day, everyone, and be well. You can follow me at Kara Sundlin for more information on the cutting edge of wellness.